Hi, my name is Janhavi Kulkarni, and I am a senior biology and global health major in the Global Health Honors Thesis program. The topic of my research and capstone project was the relationship between frontier culture and rugged individualism in the United States and the role played by these ideologies in public health responses. Living in a predominantly COVID-19 skeptical neighborhood over the course of the pandemic piqued my interest into the cultural and sociological background of these beliefs. In my research, I explored the relationship between individualism and the influence this culture had on the US public health response during COVID-19, as well as the population response to these mandates enforced during the pandemic. I argue that the ideology of rugged individualism, which fosters self-reliance, independence, and anti-civic attitudes, was largely responsible for the state of the US COVID-19 response, specifically when considering the lack of collective action and resistance to preventative behaviors such as mask wearing and vaccination. My method included using a literature review to look at the different aspects of this relationship to form a roadmap of connections between frontier culture, individualism, and the US public health response. I focused specifically on the link between frontier culture, which was the culture of independence which developed on the American frontier, and rugged individualism in the US. The definitions of individualism in the context of public health, concepts of cultural tightness and looseness, which define the structure of a society, and how those related to public health responses. I further looked at public health differences between countries with civic cultures versus countries with individualistic cultures. And finally, the role played by individualism on the US public health response, which is visible in the figures below. Figure 1 shows the places in the US with the most frontier and individualism-driven culture, while Figure 2 showed the levels of COVID-19 transmission during the Delta variant wave of the virus. Research into this field is important when analyzing and comparing the differences in COVID-19 health responses across the world, as cultural differences play a crucial role in health behaviors. The importance of culture in public health was brought to the forefront during this pandemic, highlighting its importance and the need for further research into the effect of cultural differences on infectious disease spread across the world. This issue is commonly looked at from a biological, political, and economic lens, but is rarely considered using a sociological perspective, which is now crucial. Looking at how the response changes with culture is also important for planning for future disease outbreaks, as analyzing these differences can help organizations better prepare and better equip the populations to handle future disease spread. Thank you so much.